Hello friends, I am Dr. Tushar Maniar, pediatrician from Andheri, and today we will be talking on edema. The title for the day is Edema means fluid in the wrong places. What is the goal when you look at a patient who comes with edema? We want to make sure that we are not dealing with any urgent or life-threatening condition, and also we want to make sure where is the origin and the pathology which is leading to this particular edematous condition. Now what is edema? Edema is nothing but excessive fluid collection in the interstitial area, which eventually leads to tissue swelling. This edema can be localized edema or can be generalized edema. A generalized edema is also called as anasarca. When we attend to a child with edema, the first thing that we want to make sure that it's not an emergency. And what is the commonest emergency? That with common meaning, the most important emergency is anaphylaxis. So a child who starts with breathing difficulty and starts to develop edema, you want to think and rule out either anaphylaxis or even look at other allergic conditions. Once you have made sure that you are not dealing with that, then you will go ahead and take detailed history and examination in order to find out where the source is. Here we pay importance to localization or location of the edema. To give you some examples, we commonly say puffiness of eyes early morning is likely to be the renal cause, and we'll explain why. We also say that ascites usually is a result of liver disease, and pedal edema classically comes with a cardiac problem. This is not sacrosanct and it may come in different fashions. So it's important also to note whether this is acute problem, is it a chronic problem, or is it a recurrent problem. Now let's address the recurrent edema. A recurrent edema usually happens because of either allergic condition or immunological condition, because the child improves in between, and when faced with a similar allergen or similar situation or drugs can develop edema, and then we will call it as a recurrent edema. Acute edema, the causes are one, as we already discussed, allergic conditions, but also certain renal conditions like nephrotic syndrome and acute renal failure can present with edema. Subacute or chronic conditions can be like a chronic renal failure or chronic kidney disease or a chronic liver disease or protein energy malnutrition, etc. can present with edema. When we look at the pathophysiology, then we will be able to narrow down and understand why edema occurs in a given problem. Let's take an example of heart failure leading to edema. Here, because of the increased osmotic pressure, intravascular capillary hydrostatic pressure, heart failure leads to pedal edema and subsequently can lead to further edema of the lower limbs. This is because of the dependent area that the edema starts from here. These children typically present with dyspnea on exertion, heart rate out of proportion to respiratory rate. They can also have a known congenital heart disease or prolonged fever with variable findings. On the other hand, if you have a child who is showing subtle signs of anorexia, not eating properly, the child is also showing disorders in sleep and is showing signs of growth retardation, then you start thinking in terms of chronic liver disease. And why do we say that? Because chronic liver disease may present with these symptoms much before the decompensation occurs and there is a jaundice. So ascites will develop because of back pressure of the portal venous obstruction, as well as in chronic liver disease because the synthetic function is affected and there could be associated hypoproteinemia, which will lead to decreased oncotic pressure and one would get edema. If the child is not consuming enough calories and proteins, there again it will lead to hypoproteinemia and the child can have edema, which is classically seen with protein energy malnutrition. On the other hand, this apart from as against this apathetic child who is not grown well, you have another child who is otherwise grown well. He has been happy active even today and has shown acute onset swelling and puffiness of the eyes to start with, and now suddenly bloated up and has developed anasarca over 3 to 4 days. This is your classic nephrotic syndrome. Here, because of combination of factors like hypoproteinemia due to protein loss as well as retention of sodium and fluid, one would get edema, which is fast in onset, but because of loose connective tissue starts from around the eyes and then goes on to develop anasarca. You have another renal condition where the child may present with cola-colored urine, less urine, that is oliguria. There could be hypertension if you examine the child and took the blood pressure, and this child will be having a glomerular disease. If it is acute onset, likely to be glomerulonephritis, leading to accumulation of sodium and fluid again. But here the edema will start around the eye and the face, but is usually not as severe as nephrotic syndrome. Now, if the similar child comes with chronic history of slowly progressive edema, has associated growth failure, then you would start thinking in terms of chronic kidney disease rather than an acute renal failure, which may present with edema, but will also have other features of chronic kidney disease in the form of growth retardation, hypertension, and many other conditions. On the other hand, we are in summer and come monsoon, and we all will see, unfortunately, children with fever, myalgia, coming up with a rash, and then some of them getting into complications due to a capillary leak, which will be a result of a dengue virus infection. Now, these are the children who will present with some amount of edema, but also with collection of fluid in the, say, for example, pleural effusion, sometimes because of third spacing, even in the leading to some amount of ascites. These are all the classical conditions which lead to edema. But if you have a newborn who comes with edema, the situation may be quite different. If you have a newborn who develops edema, one should think about conditions like hydrops, which may come only with swelling of the body. There could be an early sepsis or established sepsis, which can result in edematous condition. If there is only edema of the palm and the hands and the feet, and with some amount of webbing of neck and some other features, one should be careful to not miss Turner syndrome. Children, small babies, even with extra IV fluids or prematurity with hypoproteinemia can also develop edema. So these are some of the conditions which may result commonly in edema. Now, whenever we think about any condition, we have been taught that first you should rule out emergency, then look at red flags, and finally, before you conclude, you must make sure that there are no distractors or red herrings. So here you may have a child with hypothyroidism leading to mixed edema, and the child may look like having edema, but it's not actually edema. On the other hand, somebody who is put on weight rapidly may also look like edematous, but will not have edema. Similarly, some adults who are on certain antihypertensives and vasodilators like amlodipine can develop pedal swelling, which may be localized, and the cause may not be because of heart failure or any other conditions that we have discussed so far. So finally, to recap, edema is nothing but accumulation of fluid in the wrong place. And so far as you are able to understand its location, the chronicity, and understand the pathophysiology, we'll be able to find out the source of edema. Thank you very much. Next, we will meet to discuss on abnormal movements. Thank you.